All right. I'd like to take a moment to welcome everyone to today's Concordia Live, entitled Partnering with Intentionality by Beirut. I'll ask everyone joining to please ensure that they're muted. There will be an opportunity for networking at the end of this, though, as well as a Q&A portion. So those mute buttons should be able to be turned off at some point because we do want to hear from you and make sure that we're coordinated and connected and meeting each other throughout today. But just for the sake of the background noise for the first part of the conversation, we'll stay on mute. Thank you. Great, so welcome everyone. My name's Hannah Dalmat. I'm the Senior Director of Partnership Development here at Concordia, and I'm very pleased to be joined today by some leading entities within Concordia's membership. We have Carlos Sanvi from the World YMCA. We have Erica Chavers from International Medical Corps and Claude Zukowski from Procter & Gamble. Scott Jackson with Global Impact will be moderating today's discussion, and we'll be having this really wonderful opportunity to talk about the partnerships that can be most effective in disaster zones and in response to natural disasters. So Concordia's mission, for those of you who don't know us, is to convene, connect, and to create, to support that partnering ecosystem. And we're happy to bring you our learnings and our opportunities to connect and to coordinate around partnerships, even in this digital format during this strange COVID-19 time. So thank you for signing on and being a part of us on this digital journey. So today is a great opportunity to speak about the potential of intentional and strategic partnerships in rapidly evolving disaster response spaces, and the assets, skills, resources, and experiences the private sector itself can be lending into this. This is a really special conversation for us because it's the launch of the Concordia Action Alliance and an opportunity to support the great work of YMCA and International Medical Corps. I'll get into that later in the discussion, and I'm happy to share more information about the Concordia Action Alliance with anyone on this call. But before we get into all of that, let's start with a little bit of housekeeping. You're all experts at Zoom now, presumably, but for those of you who have just opened up this platform for the first time, please know that there is a chat feature at the bottom of the screen that we encourage you to use. Please introduce yourself. We want to know who's joining in, how they're listening. If you have questions, you can place them in the chat. You're also welcome to send them directly to either myself or my colleague Randy from Concordia. So that chat feature should become your best friend during this conversation. We have breakout rooms that we'll utilize at the end of the session to help facilitate networking if you're able to stay on and want to meet with others in this group. And we have little reaction buttons. So when Claude, Carlos, or Erica say something extremely profound, please react to it and let them know that you found it as such. We are so excited for today's conversation. It will be recorded and available on the Concordia website as well as our YouTube page post-event. And with that, it's my real pleasure to introduce Scott to take over. Thanks, Scott.
Thank you very much, Hannah. And I see that Matt has joined. We really, all of us, want to thank Concordia for the work you do every day to connect us and also to bring partnerships to bear around the world for marginalized communities around the world. And today we have three absolutely fantastic experts and dedicated people who are all about partnership and all about disaster relief and resiliency. So I think all of you received the bios, but Claude, of course, serves as the Global Disaster Relief Program Director at Procter & Gamble, and you'll see in her bio that she has had a number of different positions at Procter & Gamble, and all of them around disaster relief, children, and has a very strong medical background. Erica is truly an expert in bringing these partnerships together in the most difficult places. And Carlos, of course, is absolutely an expert in working with youth and working with YMCAs as General Secretary, and also brings us to bear some of the things that are happening on the ground in Lebanon. Our three speakers are going to really help us understand three different dimensions today. One of those is the whole notion of partnership and the complexities of it, but also how important it is as we confront so many different disasters at one time in our world. The second thing that I think they'll be able to shed light on is this whole continuum of disaster when you think about response, resiliency, because it really is a continuum that we're facing every day now, almost in every major issue, whether it's the global development goals or whether it's an explosion in Beirut. And finally, we'll be able to really understand what's happening in Beirut and what's happening with partnerships in Beirut and in Lebanon. So with that, I think we'll just go ahead and get started. I'd like to begin by really asking Claude and Erica, really, if you could set the stage about kind of how you came about your partnership, and particularly as it relates to Beirut and Lebanon, that would be wonderful. We'll start with Claude.
Hi, thank you, Scott, and thank you, Concordia, for this opportunity to connect with everyone here today. We actually have a long relationship with International Medical Corps going back to 2013, I believe, when we started working together as part of our Children's Safe Drinking Water program in providing purifier water in response to emergencies. And then shortly thereafter, we began working on the Syrian refugee response. So we've known each other a long time and have developed a really strong partnership. And so the foundation of that was really getting to know each other, understanding International Medical Corps' mission, how they do the work that they do. And frankly, we were really impressed with their ability to respond anywhere in the world, often the first being on the front lines, and really the services that they deliver, which are so impactful. And not only do they have the training and expertise and personnel to deliver those services where and when they're needed, but they also are dedicated to improving the communities, training the people in those communities, and leaving them more prepared and resilient for the future. So the work that they did, we quickly learned so that we could trust, support the work and where they were, and if we wanted to be a part of that. You know, over the years, we've partnered on, you know, any number of responses all the way up to the current situation in Lebanon. So Erica, I'll let you jump in and say a few words too.
Sure. Thank you, Claude, and thank you to Concordia and for everyone for being here today. And I would just add, you know, sort of our partnership with PNG, in particular, our partnership with a lot of the other private sector partners or civil society organizations we work with. And, you know, we really love this, you know, kind of idea of partnering with intentionality. And for International Medical Corps, you know, we really do seek out partners that are thinking about how disaster response can provide and, you know, and a immediate response can meet immediate needs, but that we also have partners who are there with us and understand that response and recovery is really a long-term proposition. So certainly, you know, PNG has fulfilled that for us. You know, when we really looked at how they give that, you know, both from a donation perspective, but also with the Children's Safe Drinking Water platform, you know, really looking to help communities be healthier overall. That was really important to us. And I think it really speaks to how we try and partner across the board and really look at not just how we can leverage funding, but how can we leverage expertise? How can we leverage assets? How can we leverage those types of things that can really make an exponential difference in our ability to deliver on the ground? And you know, we do approach these partnerships, I think, in a way where we are looking to develop a long-term relationship. We know it takes time to do that, but it pays off over and over again, because we really seek to work with like-minded organizations where we can build trust. And so when we need to move fast and I have to call PNG or another partner and say, we need to be on the ground, we need to get there quickly, and we need your help to do it, you know, that trust is already there, that we're going to help them meet their mission and goals in giving an impact. They're going to help us meet our mission and goals in giving an impact. And there's a real understanding as the situation changes and evolves that we'll go back and talk about what that might look like. And so with this latest explosion in Lebanon, we were able to move very quickly. We were able to say, we'll get on the ground and we'll continue to keep you updated as the needs evolve there. And because we had 7 years of experience working together, it really helped us to be able to do that with PNG and with many others as well.
So Erica and Claude, before we turn to Carlos, you both have talked about a couple of things that you might just share a few more comments on. One of them is this notion that partnership doesn't start at the same time as the disaster, that you have this long-standing relationship, but that having a partnership in place is important. Secondly, you've talked a little bit about intentionality, that not only do you have a partnership, but you've thought about how that looks not only in terms of funding, but skills, geography. Could you both just share a little bit more about kind of what that's meant to allowing you to be able to respond to, for example, Lebanon in the current situation?
Sure. Yeah, absolutely. And so I think, I always say, my team is probably tired of hearing it, partnerships aren't developed after a disaster strikes. It's really much too chaotic. Everybody needs to move so quickly. We really need to get these partners and be talking to our partners before anything happens. So for us,
hold on, Erica.
Yep.
Everyone, don't forget, one of the limitations of Zoom is that we all have to make sure we turn our mic off. So please mute if you can.
Apologies, there are some challenges with Zoom at the moment where traditionally we'd be able to mute them ourselves, but that doesn't seem to be able to be an option at the moment. So it is imperative if everyone could please kindly turn off their mics if they're not one of our speakers. That would be great. Thank you so much.
Okay, back to you, Erica.
Sure. So, we do really seek to partner with organizations in advance. And I mean, kind of, certainly P&G is one of them, but for us, we seek, we really think through the different steps of an emergency as well, and try to think about what kinds of partners do we need to help us move quickly. And so as an organization, we've sought out partners with people like FedEx, who helps us get our supplies and get our people on the ground quickly, with people like Airbnb when we know we're going to need to house some of our responders as well, with pharmaceutical companies who can provide GIK. We've really thought through all of the pieces of the response and have targeted going after partners in all of those different areas, so that when we're thinking about the operations side, where can we use help? Where can we augment our own expertise with the expertise of these partners? We've really thought creatively about that. And we've looked for partners that are thinking creatively about it as well, that are really looking to, put their assets to use, to put the things that they provide to use, to, leverage the expertise of their employees. And so, really talking through that and having brainstorming sessions, talking through what might work. And we find we have great partners, across the private sector that are really engaged in doing things like this. Then when the emergency strikes, we're able to turn it on so quickly. We're able to go to these partners, be specific about what we need, specific about what we don't yet know, but ask for their help. And they have really come to the table and helped to brainstorm with us, and really help us think through things like how, what are the needs right now in Lebanon specifically. We're having conversations with our pharmaceutical partners about what are the needs now and what are the needs going to be in 3 to 6 months, because the supply chain has been so significantly impacted. And having partners that think through that are creative and that will be there with us, really then helps us to move very quickly and helps us to address the specific challenges we'll find in a disaster, whether it's an explosion in this case, or for us, a displacement or humanitarian crisis, or a rapid onset natural disaster. They're all a little bit different, but they, having those experiences in place, the paperwork, the MOUs in place really does help you to respond very quickly when the time is needed.
Thank you, Erica. And Claude, how does that intentionality and pre-positioning of the partnership, how does that help Procter & Gamble for the other corporations and INGOs that are on the call today?
The pre-positioning, I think, and intentionality, as you mentioned, really are the most critical pieces to have in place before anything happens. I mean, as a consumer products company, we want to be a force for good following natural disasters and other events by being able to provide things such as clean water or everyday health and hygiene products. We don't have a means to do that unless we have partners that are working together hand in hand with us to be able to deliver those critical supplies. They're the ones in the field. They're the ones that are going to be on the ground helping to reach, as many people as possible. So building those relationships and those capabilities and being pre-positioned in advance really is the number one key to enabling us to do the work that we do. And we do have a large pre-positioning program around the world. We anticipate where there's going to be cyclical flooding, and we can pre-position there, having product supplies, warehoused and ready to go when needed. Those are things that we've developed and worked with partners over the years to do. So, and as Erica said, when something happens where there's a response and more aid is needed, and we can provide some financial assistance to that, it's those partners that we know and trust that can call us and say, this is what's needed, this is why it's needed. And that allows us to, weigh all those considerations and make that decision to help, because we have that personal relationship. We know the capabilities. It really comes down to, building that strong partnership before anything happens that enables us to be able to respond as quickly as we can.
Fantastic. So now I'd like to turn, if we can, to Carlos. And Carlos, please share a little bit about YMCA's work around the world, but also in Beirut, and also kind of tell us a little bit more about what's happening on the ground, if you don't mind.
Thank you, Scott. I'd like to say thank you, Concordia, for this opportunity, and thank you to my peer, Claude and Erica, for this great opportunity. I feel so honored to be speaking on behalf of my colleague from the Lebanon YMCA. In fact, they are the most qualified to talk about this, and I'm sure they're also connected. So when we go into the break room, you can hear more from them. So YMCA in Lebanon is a 130-year-old organization. It's been created in 1890. So the experience, they are on the ground, they are the Lebanese, and they went through all the steps of what happened in this country. And as you know, the situation in Lebanon is not just about the explosion. There are so many things happening. So when we talk about intentionality, I think the key word I want to put is a trust, is a reliability. And this is what I want to bring from the YMCA. This is my colleague. We have this trust that come rain, come sunshine, they are on the ground. They are not going anywhere, and they know what it is, and they are able to prove year after year that they are reliable. But something I want to share that we are not saying too much. When I was talking to the CEO of YMCA Lebanon, Issam, he said to me, because our office was damaged, they say, we fix our door, we fix the glasses, but we don't know when we will fix ourselves, because this have a trauma attached to it. It will take a lot of time to fix ourselves. And that's so important for us as a YMCA, because it's not just the material damage, it's the personal damage, it's the moral damage, it's the trauma that comes with it. Fortunately, the YMCA on the ground have the know-how to deal with psychosocial support to refugees, to other people, and going through that themselves, they are the best person to go and to help it. So YMCA Lebanon is one of our, we have YMCA in 120 countries around the world. It's one of the oldest one, the most experienced YMCA. And I'm sure that there is no other good partner than the YMCA Lebanon to address the need on the ground.
Thank you for that. And could you share a little bit with the audience kind of what it looks like on a daily basis in terms of how your team's responding? And I'll come back to Claude and Erica as well on that question. But please share a little bit, Carlos, about kind of what it looks like in terms of taking care of the self as well as the community.
Okay, thank you. You know, when the explosion happened, before we heard it on the international news, our members in Lebanon told us already. We knew before it went to the international news. And we spread it around our membership. That's the fast mechanism we have in place that we can hear directly. But after the shock, we are so pleased to see our YMCA, they mobilize young people. I think the first day there are more than 80 young people, young volunteers who are mobilized and are monitored by YMCA to go on the ground to help people. They were also affected. But in the YMCA, we don't care too much about ourselves. We care for the others. So those young people just have the time to put some YMCA t-shirt on to go and to help people. The second thing they did is to do a quick survey to know what are the help, what are people needing this. And you'll be surprised to know that what comes first is the water tanks. Maybe people need fresh water, but most of the water tank was blown away. So how do we do that? Electric cooker, just to say, to make a simple tea, you don't have anything, and many other things. So YMCA was the first respondent, the young people. That's what the strength of YMCA. Young people were there talking to the people, non-face people who were affected themselves, so they can understand, they can dialogue with other people who are affected. And with that needs, we were able very quick to start mobilizing resources. Even before we do, YMCA Lebanon also were addressing those resources to the most privileged people in Lebanon. So currently there are so many other programs going on. One of the biggest programs of YMCA Lebanon is the medical program, where they reach out to more than 200,000 patients across 450. They distribute medical to people more in need. So after the first 2 or 3 days, they were able to continue, because for them, the mission needs to continue. They need to reach out to the most underprivileged people, regardless of what is happening.
Thank you. And they're doing all of that in the context of a global health and economic crisis and all the other factors that Lebanon has had to endure. Erica, can you share kind of what the response looks like for you on the ground, and also a little bit for P&G, and we'll ask Claude to respond as well.
Sure, thank you for the question. And you know, for International Medical Corps, you know, like the YMCA, we had programs already existing in Lebanon. We had about 300 staff on the ground there across the country, working with 50 community-based health clinics. And about 100 of our staff were in Beirut at the time of the explosion. Very thankfully, while we had a few injuries, nothing life-threatening, nothing terribly serious, although many of our staff members did lose their homes, and we did lose our office space. Ironically, the outbreak itself may have actually helped to reduce in some ways the impact of this explosion, because people were at their homes and not necessarily at their office spaces or in that particular area downtown. But we, you know, did have and often have, because most of our staff members globally are local to the communities where we work. We really do think about this self-care piece of it as well. And we had rolled out as an organization a self-care program for our first responders as part of our COVID response, and have been able to leverage that to provide additional support specifically to our responders themselves. You know, when we're thinking about partnerships, our partnerships in Lebanon, our implementation partners, were just as important as any kind of funding partners that we had in responding to this. We work with these 50 clinics. They are local community-based organizations. We do have a partnership with YMCA. We have a partnership with other organizations on the ground, and we were able to sort of leverage those as well. We were able to move goods and supplies from warehouses outside of Beirut into Beirut to really deploy mobile medical units and really look at you know, how we could provide acute care. We moved that personal protective equipment, the PPE, into Beirut and distributed it to people who were supporting medical needs, but who were also supporting cleanup. You know, Scott, you mentioned Lebanon's in the middle of a financial crisis. They're certainly continuing to deal with the impact of the Syrian refugee crisis. They have also seen a spike in their COVID cases, you know, immediately following the explosion, up hundreds and hundreds of cases per day. And so really trying to protect health workers and volunteers who are out there responding to the explosion. So those were some of our immediate needs. You know, long term, we're looking at how do we help these communities recover? How do we continue to provide access to care for people who are now displaced? 300,000 people have been displaced. And not just for acute needs, you know, we're really thinking about non-communicable diseases, chronic diseases as well. How do they continue to get care for that and for medications when health facilities have been destroyed? And as, you know, Carlos also pointed out, what are the mental health impacts of this, of surviving this trauma, perhaps losing your home, members of your family, and how we can help those communities overcome as well. And so we are taking a longer view to this. The needs will still be there. And I think the people of Lebanon, and certainly Beirut, have been through so much. And so we want to make sure that we can continue to be there and continue to support them.
Thank you. Thank you for what you're doing and with all of your local partners, including YMCA. Claude, can you share a little bit about what your side of the responses look like in Beirut and Lebanon?
Yeah, absolutely. Well, first of all, I mean, our hearts definitely go out to all the people of Lebanon that have been affected. And, we certainly want to do our part to help. First, we looked at our employees and partners to make sure that they were safe and okay. So I'm happy to say that, we've confirmed that everybody that was present in the area was safe along with their families. Although, like everyone, they're dealing with quite a bit of damage. Quickly after confirming that, we really mobilized to figure out how we could help. We've pledged a significant amount of funding to be able to provide products. So everyday health and hygiene products, diapers, feminine care products that we're going to be distributing throughout the area in collaboration with some of our local partners. We have a long-term relationship with Red Cross Lebanon, who we work with for years. So we're working with them and others. We are pledging some grant support to organizations like International Medical Corps and others to help with the rebuilding and rehabilitation of schools, hospitals, and so on. And we've established an employee matching gift fund for those that want to give back. We will match those donations and provide them directly back to the community and to organizations that are responding.
That's fantastic. There's a very comprehensive response, really, including your employees.
Thank you.
Great. Well, we've learned a lot, I think, this morning in a short period of time about what's happening on the ground in an important part of the world right now, but also what intentionality and what impact really looks like when you think about partnerships. And I'll just add that I think partnerships are so much more important than ever before if we think about our ability to respond not only to disasters, but to the long-term resiliency and development needs that all of us are seeing and facing as we look at this kind of very interesting time of global health, economic, and really ongoing crises, man-made and otherwise. So with that, I'm going to turn it back over to Hannah to talk a little bit about what Concordia is doing to really move some of these partnerships forward in the disaster continuum.
Thank you so much. Thank you so much, Scott. And thank you to this really wonderful panel for showing us not only the work that they do around the world, but specifically what they're doing in response to what's needed most right now in Lebanon. So thank you for this. I'm very proud to right now speak about a new initiative for Concordia. It is called the Concordia Action Alliance, and it is in many ways the manifestation of Concordia's Convene, Connect, Create model, with its design to rapidly create collaboration opportunities and advance best practices to support response and recovery, resiliency and prevention efforts as it pertains to natural disasters, man-made disasters, and this global pandemic that we all find ourselves in right now. So this idea has really been developed over the past several months, but is building on a set of programming that Concordia has had with regards to partnerships in the disaster response space. We saw many of the same actors taking leadership roles in response to COVID-19, International Medical Corps and YMCA Lebanon being among them. And with this in mind, we thought that it was an opportunity for Concordia to lean in on the partnering best practices and strengths that we are known for. And through this, what we're doing is creating a year-round platform for our members to engage in response and partnership formation as it pertains to this important topic. The idea is to more rapidly coordinate and to emulate some of the best practices we've seen in different industries and different sectors when it comes to partnership, and to scale those to places where those partnerships and that sense of collaboration is not yet there. It's to work with amazing private sector entities that have a legacy and a history of partnering in natural response spaces, and to identify more opportunities for them to be more effective around the world. It's to work with new entities that are trying to figure out what their role is in this new and strange time, and to ensure that they're bringing in the best practices and finding the partners in the most efficient and effective way possible. So this communication space, this convening area, will also be associated with a Concordia Action Alliance fund, which we're very proud of as well, because it's an important part about ensuring that action happens. We're not just talking about it here at Concordia, but we are actually seeding collaboration and funding the type of partnerships that you have heard Erica and Carlos speak about, and the work that they're doing together in Lebanon. To be clear, we did not have anything to do with that, but we're thrilled to see it happening. And it's what we want to see happening between our alliance members. And so the Concordia Action Fund is officially being launched as well alongside this alliance. Today's webinar is an opportunity to support that fund. And if you're interested in supporting either the initiatives of the International Medical Corps or YMCA Lebanon in their recovery and response for the Beirut explosions, but also their life-saving work that they've been doing for months and years now in response to the pivotal leadership role Lebanon is playing in the region and the needs of its communities and vulnerable populations there, this fund is a great way to do so. And I'd encourage you all to consider exploring ways that you as an individual or you as an organization or you as a company might contribute towards that fund to directly support YMCA Lebanon as well as the International Medical Corps today. We'll put in the chat feature my email, and you can reach me for more information about how to potentially support this fund or what it will be going towards and how it is part of the broader Concordia Action Alliance space. If you're interested in the Action Alliance as well, please reach out because we're so excited to be bringing in new members. International Medical Corps is one of our first members and has been a real leader in helping us think through how this can be most effective and helpful towards groups like them. And we're thrilled to be carrying that conversation on with others, including now, most recently, Global Impact. So this is an exciting space for us, and I think that Erica, Carlos, and Claude have given us just amazing context into why it's important that these partnerships exist and that they're supported effectively or correctly so that they can be as effective as possible. So with that, I would just love to continue this conversation. We'll move into question and answer. So if you do have questions, start putting them in the chat feature or turning on your video so we know that we should be calling on you soon. We really want to make this a conversation. But in absence of that first question coming through, I'd love to just start with one. Erica, Carlos, tell us what impact any collected funds from this Concordia Action Alliance Fund would have on your projects. How would these dollars be used? What kind of impact would our audience know that they're going directed towards?
Okay, I will start. I think the present and the future of any national lion is young people. So what is the strength of the YMCA is to mobilize the young people to regain hope and to become a change maker in their community. So the concrete action or impact is that young people, instead of getting away from the problem, they are facing the problem. They are helping out. So concrete work, like as I already say, buying water reservoir, make sure that the most affected family have running water that they can use. For the YMCA also to continue the program they have a medical intervention, including 150 more dispensaries across the country. It will help YMCA to continue this work. YMCA provides psychosocial support to group of refugees, including the Syrian refugee. YMCA will continue to give that support to them. We have vocational training centers, entrepreneurial program. All those programs are needed now. And if there is any time that Lebanon needs us to come as a partner, because we really believe that not a single of us can face that challenges. But when we come together, we'll be able to address, everybody bring his own expertise to it. So our impact is more related to the human impact and also addressing the need of the most vulnerable. And YMCA Lebanon has a tremendous experience in reporting back and showing you your impact, the impact, so that you know in a single dollar you will invest, you'll get a report for it.
That's great, Carlos. Thank you. And I love how it's the investment model that YMCA champions around the world is truly about community empowerment and helping to direct dollars where people on the ground believe it's most necessary. Erica, do you want to speak about International Medical Corps as well?
Sure. And thank you for the opportunity. You know, International Medical Corps' mission is to provide healthcare where and when it's needed most, but then also to do that investment in the training and the capacity building moving forward. And so over the next several weeks, our focus is really on the 13 most affected health facilities that are in and around Beirut. And we're looking at, you know, the 15,000 people that those health facilities serve, you know, on a monthly basis, and how we can make sure that they're getting access to care. So in the immediate future, you know, funds are going to help bring in medication and supplies, deliver that critically needed PPE so that people feel safe going to health facilities, getting these health facilities doors open and operational. And that's really our short-term sort of acute goal. You know, longer term, we are looking at a couple of things. Certainly, how can we help to build the capacity of those health facilities moving forward to continue to respond in their neighborhoods, to continue to meet the needs of, you know, of refugee populations and of local Lebanese. We'll be looking at and investing in their mental health capacity as well. And then we're also looking at how do we make sure women and girls stay safe? You know, one of the unfortunate byproducts of a lot of disasters is that women and girls are more at risk. They're more at risk from a security perspective. Their hygiene needs aren't often met. And so we're also going to be looking at that as well, and making sure that there's programming for women and girls, that they have ways to stay safe. And that if they need additional help or services, that they're referred to the right places. And so throughout all of that, we'll be working very closely with ministries of health, with the clinics themselves, and really making sure we're filling in those gaps so that you know, we can just continue to provide this access to care.
That's wonderful. And of course, with the complexities layered on through COVID-19, a lot of the social safety networks aren't accessible at the moment, especially for women and girls. And so that's where the comprehensive partnerships that International Medical Corps builds out with public officials and local community outlets is just so important, that not only are people able to continue to rely on these for the services, but that broader, it's informing a rebuild strategy. So yes, wonderful. And as you can see from what's been shared throughout today's conversation and just now, we know that those funds would be well used and that there would be very clear reporting metrics to show back. So excellent. Great. We do want to field questions. So if you have any questions for Claude, for Carlos, for Erica, or for Scott, please do let us know. We want to make sure that people are asking about how to create these partnerships in their real time, in their own work, and learning from the expertise that's brought into this panel.
This is Scott. I have a question. For everyone, and including you, Hannah. This is very bold. I just got a briefing on it yesterday about the Action Alliance and the fund. And as I understand it, as you and Erica look to design this and work with other partners and members of Concordia, the whole notion was to make sure that you had catalytic funding prior to disasters that could be perhaps small amounts of money, but could really help move things forward and be able to leverage other dollars as well. And secondly is, how did you begin to think about this need and design for Concordia to really have a long-term disaster network? Because that has come out of your work the last 2 or 3 years, working with Procter & Gamble and others. But could either of you, or certainly Carlos or Claude, share a little bit about how important is it to have a global network, and how important is it to have catalytic funding like this, unrestricted funding?
That's a great question, Scott, and I'll certainly ask Claude, Carlos, and Erica to weigh in on this as well. But from Concordia's perspective, in our earlier conversations over the past and most recent years around natural disaster, we've spoken to many groups that have expressed the challenge of accessing rapid capital. There are amazing funding instruments out there, but they take time. Even when you know, due to weather patterns or predictability, that something is coming, to actually unlock the necessary funds can take weeks, months, in some instances, years, right? And that's lives at stake. That's impact falling through the cracks. And so the idea here with this catalytic capital is not to be project funding. It's to take a great idea and to incentivize it as a partnership. what we're trying to do is support the actual mechanics that come with creating a partnership. And we at Concordia know that it's not a simple send an email and get things done, but it requires time and to Claude's point, intentionality, really thinking through what all different partners can bring to the table, what their comparative strengths are, what the gaps are, and coming up with a robust, solid strategy. That's time that not everybody has, especially in a disaster response instance, when things are so chaotic, things are moving so quickly, and there's this demand to get things done. So the fund that we have is intended to help offset some of those barriers. It's to help them hire a new grant writer or somebody, or to contract out staff time so somebody can take this on and give it their full intention so that it can really quickly from a conversation turn into an action plan and a roadmap. It's to create that feasibility study that can unlock bigger grant funding from some of the great institutions out there, both public and philanthropic, where they just need to better understand what they're getting into to finance it. It's a lot of those feasibility studies are not funded. And so if a group doesn't have that seed funding, and why would they for a disaster that they weren't expecting, you just can't get those ideas off the ground. There's so many great ideas that just sit on the ground. So that's the intention behind it. And that's why we thought this rapid, small amount of capital could actually play a huge role in incentivizing those partnerships and getting them up and running.
That's great. Erica or Carlos or Claude, any additional comments you'd have there?
Yeah, I mean, I would just add to that. I mean, you know, from our perspective, and when we were talking with Hannah and the Concordia team about this, I mean, this was so important for us. I mean, we, the metric we measure ourselves by around partnerships is that, a new partnership can take generally 12 to 18 months to get off the ground, right? From when you're initiating those conversations, really starting to talk with each other, and kind of understand how you work, where, you may be able, where there are synergies and where you can leverage each other's assets and expertise. And so, that takes time, that takes effort, that takes energy, and having a little bit of an incentive certainly helps when you can also invest in feasibility studies or gathering more information that are going to make that partnership happen. What we find is that disasters, the challenges of disaster often provide an opportunity to road test a partnership that may have been in development. And so again, having a little bit of catalytic funding that can help try something out, pilot something new, test a theory that you've been working on, means not only do you have the opportunity to give back to that disaster, but you could really change the way that you're going to work moving forward. And we've had opportunities with partners. I think of our partnership with Tesla, where we tested using their solar energy solutions in a disaster, and we had to test that first and really kind of work with it, and now we're able to use it moving forward. But you can never test it as well as you can when you're in that disaster environment. So again, having a fund or funders who really think about that and think about how can we help kickstart these partnerships is fantastic, and we're excited to see what can happen.
Yeah. Allow me to make myself a little bit vulnerable here. I was a refugee myself. And then after that, through the YMCA, I found myself in many disaster areas, helping community, building the capacity of our YMCA youth worker. But there is nothing disempowering than not having the resources to help people. And at the same time, you cannot be doing the paperwork and helping people. But when that happens, you need to be on the ground. You need to be there to help people and to give a helping hand to people. So I like to applaud, really, and I want to applaud you for this Action Alliance Fund, because the intentionality behind is to relieve the first burden, to say, where is that coming from, knowing that we are part of the family that is taking care of that. So those people on the ground, the first responsibility is to reach out to the people the most affected. But we also need to play our part. So this is what we are doing, and I really applaud it. And then if through our relationship we can mobilize other people to make sure, then people will see this big network of solidarity to make sure that people have hope. Because when people are so down, bringing a small hope is a very light you bring to them to say it's going to be okay. But you don't say it just by word, but you need to be concrete. And this is how we need this network, this partnership, to make sure that it's concrete to help our people recover their hope.
Well, thank you, Carlos, and thank you for sharing just a small element of your story and for being the other. I think that that was such an important comment that you made earlier, is that all of us have an important role to play in taking our own stories and our own journeys and making sure we become the other, particularly in times of disaster. Claude, tell us a little bit for you how this catalytic approach has meaning.
So we've met lots of our partners through the power of convening networks. So I think it's a fantastic idea to bring together all of these groups. I mean, at the end of the day, it can be a little hard for the private sector coming into this particular space. And so I think having all that expertise together really helps guide companies that might be interested in getting into this space. I mean, at the end of the day, it's about understanding what's needed and how that can best be delivered and how we can achieve the most impact. I don't think it's always intuitively obvious for some companies. Obviously, if you're the transportation industry or you know, there's a very logical connection with disaster relief, how you can get involved. So I think these forums actually help you know, bring to the forefront some of those ideas, how companies really can truly play a role and how partnering with these organizations can lead to greater impact and the benefit that can have for their companies, for the consumers that are looking at them to be contributing to helping when there's a crisis in times of need. I think that you know, it can't be understated that is something in today's world that I think is really important. And so having this forum, I think, is an excellent way to bring more awareness and to bring more corporates together in this space.
And Claude, I think you brought up a great point where this is not always intuitive. There's a strong list of private sector entities that routinely show up. And they come from some pretty traditionally assumed sectors, consumer goods, transportation and logistics, right? And that's awesome. But COVID-19 has kind of turned the world on its head in such a way that for the first time you see companies realizing that they are affected about as well at the same level as everybody else, and that they need to come up, they need to be more prepared on their side with a plan. And it takes partners to come up with that response plan. And they can have an opportunity to be more effective externally as well through partnerships in the response. And so they're learning in real time as well. And so the idea of coming together and hearing from peers who have successfully executed partnerships time and time again and seen real benefit into it, and to be in a space where they're learning from them or have the forum to be asking questions, it has this opportunity to turn a partner or to turn a company from a check writer into a partner, right? And there's this great question in the chat. What kind of partnerships are each of you in biggest need of? And she goes on to continue, perhaps not just from a funding lens, but with on-the-ground service delivery partners or partners to highlight awareness of your work. So in taking away any kind of in-kind or monetary inputs that you could provide, the idea of the skills and the expertise that private sector entities hold around the world. And I'd love to hear again from the panel on kind of hone in on that. Is there a specific skill or expertise set or element that is really paramount for what's going on in Beirut right now?
Well, if I could just build on that with an example, Hannah, I think, you know, in addition to being a consumer goods company, we're also a large advertising company. And so just using COVID as an example, I mean, one of the things we've done through our advertising lens is to create campaigns that raise awareness. Yeah. We've done this by shining a spotlight on the partners that are responding and, you know, doing videos and posting about their work and the impact that they've had, as well as creating campaigns, whether it's been, you know, how to properly socially distance, or here in Ohio, we're doing a big mask on campaign so that, you know, we can encourage more people to wear masks. So I think, you know, whichever industry you're in, I think there are creative ways that you can help to contribute.
Great.
I would like to say, as a YMCA, disaster is just one step. And I want to share this with my Lebanese friends. It's our biggest hope that despite whatever is going on here, soon Lebanon is going to rise up through COVID, rise up to the political challenges, rise up to this explosion and many other challenges. That is our hope. That our work is to build the resilience of our organization and partner organization to journey with the nation regardless of whatever happened. Now is explosion. It's going to be COVID, might be something else. When the YMCA is a resilience, when the medical corps, they are resilient, whatever happened, you'll have a way of addressing it. So to build that resilience is beyond money, is a lot of know-how, is a lot of expertise that we need to put together. And we are talking about partnership here. It's part of the sustainable development goal. And talking about that, we are talking about sustainability. How do we become sustainable? How do we build sustainability in whatever we are doing so that we don't just stop when everything goes to normal? We continue this work because it's about resilience, it's about long term. And that's, we need a lot of partners coming with different expertise and different skill to help those organizations to become resilient.
I couldn't agree more, Carlos. Thank you so much. And I would just add that we, to Claude's point too earlier, we really encourage people to think creatively about what they have to offer. We've had some really great partnerships in the past that don't on their surface kind of look like disaster response partnerships. But for example, as an organization with staff in 30 countries globally, we have a tremendous amount of human resource needs around, what are local rules and regulations? What are the regulations when we're going into a new, into a country because of a disaster? What do we have to know and take into account? And that's a task, I think, that our partners often don't think that, that's not the first
I
thing.
wouldn't have thought about that, but
yeah.
Right.
Yeah, and with COVID, every country now has different regulations and guidelines for their health workers in country, and we have to make sure as an organization that we know what they are, that our staff knows what they are, and that we're abiding by those to keep our staff safe, but also to keep the communities they work with safe, and make sure that we know what they are, and that we are maintaining social distancing, rules and regulations. And so for us, having an organization with a deep understanding of global HR policy and practice can be a real asset to us, especially when there may be a lot of known or circumstances are changing, or we're going into someplace new. And it's in HR. There's finance things that mirror that as well. And for us, while we have a great team, there's always kind of more than we can handle. So really thinking creatively about getting beyond sort of even your core business and thinking about what are the other assets you have as a company can be really, really helpful.
I think that's great. And each of you pointed to just the complexity of the work you're doing. And to be sure, you're each showing leadership, but I appreciate that you identify the strengths that others can bring into the fold as well. And I think that's very important. So with that, I would just like to say thank you so much to our panel, to Claude, to Carlos, Erica, and Scott for this really robust conversation around the importance of partnering in disaster response areas, but in doing so in advance, during the blue sky windows, when there's time to think and to craft. Erica, you mentioned that a partnership can take 12 to 18 months to construct, and that's why it's just so important to have those process points in place so that when a disaster does strike, there's the opportunity to really kind of show up in the best way possible. And thank you to everybody here for showing up in the best way possible. With that, thank you. We will have this video sent to all of our attendees so you can watch it, rewatch it, memorize all the great points. It will be also online, and we encourage you to share it with others who might be interested in this space or theme, as it will be a growing point of interest for the Concordia team here. If you are interested in the Concordia Action Alliance or the Concordia Action Alliance Fund, and other ways to be supporting the good work of World YMCA and the International Medical Corps, please contact me, Hannah Dalmat at Concordia. And otherwise, I want to say thank you again, and I hope to see everybody here also on screen at the upcoming Concordia Annual Summit, which will take place September 21st to 25th, and we can't wait to see you there. All right, thank you, and have a really great day. Bye.